Okay, it's 5 o'clock. I'd like to call the Health and Human Services Board to order on December 20th at 5 p.m. in the St. Croix County Government Center, room 1284. Roll call, please.
Dr. Anwar, he's excused, right? Yeah. Julie Smith.
Present.
Lisa Lind.
Present.
Sean Anderson.
Present.
Kathy Leaf.
Present.
Dave Osnes. Present. Greg Telejohn.
Present.
Mike Barkalow.
Present.
Deb Lindeman. She's excused as well.
Excused.
Yeah.
Minutes were provided from the last meeting, Wednesday, October 18th. Is there any corrections or additions or objections about anything? If not, they'll stand approved as presented.
He's just stretching.
Is there any public comment tonight? Any public comment? Any public comment going on? No. Business items, Health and Human Services monthly financials, please.
Okay. So the financials that are in the packet are through November of 2023. Throughout the year, we've been talking about our purchase services and, that they've been trending very high. As we're winding up to the end of the year, now you can really see that impact when you start looking at our bottom numbers here. When we compare November of 23 to November of 22, our revenues are ahead by like $1,477,000. The balance remaining shows that we still have like $5,900,000 in revenues yet to collect. Some of those we will not get. Some of our contracts have been underspent, so ARPA funds, when you look at like the 43310, we had budgeted as if we were going to have fully staffed all year. Some of those vacancies were open. Some of the other initiatives started partway through the year. So again, like that budget number, we won't fully get that much in. But of course, the expenses are lower to go with that. So grants, when we go to the next page, so salary and fringe, we're showing we have 17% remaining. As I said, we've had some vacancies, so that is really on track for what I expected. When we get to our operating expenses, you'll see we're over budget by $866,000. We still have 2 more months of expenses that will get posted to that line. So then when you see our bottom number on the next page, page 9, currently we're at a negative $3,758,000. So that's not where we'll finish. It won't be that bad, but there's a good chance we will finish with a negative balance this year. Just looking back, so the past few years have been very, very good for us. But back 2018, 2019, we did finish negative those years too. So it's not unusual, as we try and budget very close to what we're expecting, there's a chance we'll go over budget. And then we do have fund balance that will help cover that. When we go to page 24 for the healthcare campus, depreciation has been posted now, so that was January through November, just got posted here in November of this year. That shows the healthcare campus with a negative balance right now. They're fully covering their operating expenses. We also just got notice of their supplemental payment, and that will still be posted in 2023. That's $187,000. So we expect the nursing home, the healthcare campus as a whole, to finish as a positive number. Are there any questions on the financials? Any particular line items I can answer questions?
Any questions? Sounds good.
Okay, thank you.
Thanks. Review of the collaboration between economic support and the jail to improve Medicaid accessibility.
Just use this. Yeah, I'm just going to get it there. Okay. The mouse is really being crazy.
Easy, great. Do you want to do it then? Oh, sorry. We were just trying to figure out the
The mouse is being finicky tonight, so.
I'm Rhonda Brown, the Economic Support Administrator, and Bob had asked me to come and present this information that I actually just presented to the Western Region Mental Health and Criminal Justice Collaborative yesterday. So I tried to add a few more notes that would be more pertinent to this group than that group, but pretty much the same presentation. In terms of suspended Medicaid, so this presentation really is about that not too much of the detail on that program, but the availability of that program, in addition to accessibility. So it doesn't help to have new programs if they're not accessible to those who could use them, right? I believe DOC and DHS, so Department of Corrections and Department of Health Services, collaborated themselves on the suspended Medicaid program for roughly 6 years, I think, before it went into effect. It used to be that we would terminate Medicaid when somebody was incarcerated, and suspended allows us to put them in a suspended status. So if someone is open for Medicaid when they go into incarceration, we can put it in a suspended status rather than terminating it and requiring a new application, which is really just more efficient for everyone. So the basic policy is up there. One of the things that I had noted that, if you want to go to the next screen, we had begun receiving questions, our leadership team in our division had begun receiving questions about Badger Care from a social worker who in behavioral health who works with the jail. So I just asked if she wanted to get together so that I can understand what she does and she could understand what we do so that we could figure out how to best support her. And it was really through her questions that I realized there was not a lot of knowledge of suspended Medicaid, which again, unfortunate considering it's for that population. And then also there was confusion around other programs that we administer as well, such as food share. In addition to that, since this went into effect in 2020, we have been referring them to the Great Rivers Call Center. So we're very confident in our call center, our agents, extremely timely and knowledgeable services through our call center. So we tend to refer anyone there for the most efficient service. However, I learned in discussions with her that as part of the call center, the initial call, they are required to self-select a queue based on what they're looking for. And in the equipment that they were using, it disconnected them immediately. So here we had been referring them to years to utilize a door that they couldn't open, unfortunately. So that's kind of how the discussions began. A few more things that I just wanted to note. The behavioral health social worker, said she was unable to connect them, like I just talked about, but also just that, workload-wise, when they're using her equipment and she has a need to have to monitor them in the space, that takes her time as well, which limits the number of inmates that she can serve, and other things as well. Also, in talking with the jail captain, she had indicated that when they had applied for benefits in the past, that she had received some letters from DHS about potential fraudulent activity. So I wanted to learn more about that. That shouldn't be happening with the suspended Medicaid status. And learned a little bit more actually yesterday, the presentation prior to mine at the committee. She went into a little bit more detail about the disconnect between DOC policies and DHS policies on their end. So we've figured it out on our end, but there's still some disconnect on that end that caused us some confusion, which was interesting for me to learn. The overall message, right, is it's good for partners to talk and have discussions and connect, because we learn things like this. So in a place that we thought that we were serving all individuals that needed this service, we weren't. So kind of ran with that at that point. Just a list of stakeholders here. Obviously the behavioral health social worker that I mentioned earlier. I then reached out to our Great Rivers Consortium partners, which if you recall is Barron, Burnett, Chippewa, Douglas, Dunn, Pierce, Polk, us, Washburn. And just to see what they do locally. So even though we operate as a consortium or as a regional entity, we obviously, each of us, our IM agencies or our divisions are still working locally with our local partners. So there's always that aspect. So I really wanted to understand what they were doing to work with their jails. In addition, I talked with Bob, I talked with Shar, just to kind of let them know what I had learned, get their thoughts on what we might be able to do to rectify this situation. Then I'm on several state committees. I've been on committees for a long time since I've been doing this. So fortunately, I know a lot of people that I can reach out to, which was nice in this respect as well. So I expanded it just to ask others, what are you doing? What does this look like for you? And the answers varied widely. So took some notes on that. And then I actually had a virtual meeting with Dane, which was interesting. As you likely know, they're a very fast-growing county as well. We're kind of competing, I think, for number one, number two, maybe. So that was interesting to have a discussion with her about how we're not, maybe that's wrong. Anyway, it was interesting to talk with her about what they were doing, and they were doing more of what I wanted or envisioned we would do, right? So I wanted to get away from paper applications, for example. I talked to Chris Anderson, the jail captain, just to let her know what I was thinking, what I had learned, and then obviously the IT department and facilities, just in terms of what we might be able to do. The general goals were to establish just a general understanding of suspended Medicaid, both for the jail staff and the department, our department, and then other programs as well that we administer. But really, the other part of it was making sure that, you know, as partners, we want to know a little bit of what we all do, but none of us can know all the details of what everyone does. So it was really critical to me to get the more complex questions into the hands of those who are already trained to answer them, rather than trying to have them be more trained in a program than they really needed to be. Also making certain that our call center services and agent knowledge were not only accessible to inmates, but that they had the opportunity of an interactive process. So as I said, some that I talked to really relied on a paper application process, and that wasn't something that I wanted to do. They submit a paper application, they have no way of reaching us for questions, and we have no way of reaching them either. So it just, again, would seem more efficient if we can connect them with our call center. Also provide the social worker more time to manage workload, you know, be able to serve more inmates potentially. Obviously, I'm not her supervisor, but that was kind of a goal just in listening to some of the concerns that she had. And then also having equipment for them so they didn't have to try to utilize her equipment to get in contact with our call center, which, as I said earlier, didn't work well anyway. So tied up her equipment and didn't work well. And then educate inmates on programs and benefits for their own peace of mind and planning purposes while they're incarcerated and upon release. So suspended Medicaid, as I said, they can apply for that anytime. If they're open for it, they can contact us by the call center. We can suspend the Medicaid, and it can stay in suspended status for as long as they need it to. Or they can apply for it while they're incarcerated, put it, if they're found eligible, be put into suspended status, and sort of have that piece taken care of, so that all they need to do when they are released is contact us to give us a release date and have that verified by someone in the jail. Suspended Medicaid doesn't cover anything other than if they were potentially in a 24-hour hospital stay for some reason, there could potentially be some coverage there, but there is no coverage while they're suspended. Again, it's really for that planning purposes for them upon release, to make it a more efficient process for them upon release, and really anybody supporting them, which includes our staff, our county staff. Where am I here? Thank you. So next steps, I asked the jail captain to meet with our deputy director, so Shar and I, to understand really their experiences and then tackle barriers to include technology and education, right? It's kind of two no-brainers. I also obtained approval from our consortium's lead agency to use ARPA funding to secure equipment as an accessibility solution. So we had this funding. If we didn't use it, it was going to go back to the feds anyway. So it seemed like a good opportunity to utilize some of it. And as you'll see on the next bullet, the cost really when you look at the cost of a staff person to have them use their equipment, have them utilize a phone, when you look at the cost, it's, again, kind of a no-brainer. I think the struggle of even putting a phone line in the jail is a little bit challenging in my understanding, obviously based on, the structure of the jail. But they were able to really help us do that, and facilities as well, relatively quickly. So it was a great collaboration. In addition to that, our IT department was able to eliminate an issue that DHS, a concern, I should say, that DHS has. So as you guys know, our call center is virtual. There's no physical location. Genesis is what our software is that is used for our call center. Part of that software in that queue process, individuals can select for a callback. I'm sure some of you have probably experienced that yourself, calling credit card or what have you. And we didn't want an inmate to check yes, call back, because the phone's never going to be answered. So rather than having to go through Genesis, the software, to give them a number to avoid callbacks, our IT department took it upon themselves to, there's no direct inward dialing, so it's taken care of. There's no callback loop that can even occur. Question? Yeah.
Microphone.
Could you go back to that second bullet point? I've got a question on it.
Sure.
Did you need approval from the consortium's lead agency to use ARPA funding?
Right. The ARPA
Why
fund.
wouldn't we look at the county and then go to the consortium? Or what happens if the consortium says there's nothing there, but the county might have something? How does that work? Does it balance itself out, or can you explain that?
Yeah, I mean, I would talk with Bob about something if we needed something like that, but I knew that this funding was existing. It's something that we talk about at our state committees, multiple state committees every month. So I knew what our balance was, and I knew that we had money that we could spend. So again, it wasn't necessarily a factor here. But yeah, I mean, if we had an expense in general, yes, I would go to the lead agency. They fund our operations. So they contract with DHS, and then Eau Claire County, our lead agency, contracts with us to do the work, if that makes sense.
So does the counties then, in a sense, are they providing a certain amount of ARPA money to the consortium
No,
at all?
the county's 17 million of ARPA is separate from this ARPA fund. This is a separate ARPA pool that she's drawing from.
Oh, sorry, I should have thought about that. Okay,
Yeah.
thank you for the help. Now I understand where your question was
I'm
coming
in
from.
Dave's head. I knew what he was thinking.
Thank you, I appreciate that. Yes, it is separate. This ARPA funding was for the consortia statewide, directly to us.
And then one more follow-up on it, if you
Yeah.
don't mind. And then when that money is done at the end of 2024, what happens?
For us, it actually is done. I think there's some existing funding related to Medicaid-specific stuff. But I think for the most part, ours is done at the end of 2023. There might be a little carryover into 2024, but those discussions go on at this time, so. And we had some available, the ARPA funding was so specific about what we could use it for, and we did brainstorm a ton, I feel like. There are other things that we did with ARPA funding here in St. Croix County with our ARPA funding. So mostly around technology, I would say that, I don't have a number, Faye, but maybe 20,000, somewhere probably around there. That's off, don't hold on to that number, but, somewhere around there, so. Yeah, scratch that. My point is, we did several other things with that, so, that I got approval from our lead agency. Again, we knew the money was gonna go back, so if we can do it, use it to benefit our department or operations or collaboration like this, again, why wouldn't we? The additional steps, so again, these probably are more from the presentation that I did yesterday, because it was really telling them what we did so they could think through it, a little food for thought for what they might do locally. So we ended up, the first couple of calls from the jail unfortunately didn't go well. So I didn't realize there was a training opportunity on our end until those calls didn't go well, meaning that our agents were also confused about suspended Medicaid. It doesn't come up often. So it was a good opportunity for us. We have it's called The Hub. It's our intranet site that I actually manage for our consortium. And we posted some training and some information there to remind them not to tell those callers that they can't apply until after release, which is what they had done, unfortunately. So as with anything, there's some bumps, but again, it's these kind of things always present opportunities for learning and doing better. So that's how I'm trying to look at it. I have not heard any concerns or complaints. I did reach out to Chris just to see if she had any feedback for tonight. I didn't hear from her yet, but I have not heard anything negative about it. So no news, good news, right? Also, I ordered publications and postings to be sent to the jail. So I provided them business cards so that they can give them a business card upon release. That has information not only about our consortium, including contact information, business hours. It also has information about access. .gov, so something that they can utilize 24/7. We Badger Care Plus posters with tear-off sheets with some information, and then a Justice for All poster, which is really just speaking to covering the civil rights aspect of program and service delivery. So got to cover all bases. And then we had come up with some collective wording there. So really just how are we going to present this to inmates so that they recognize that this was an opportunity for them. So again, the accessibility, the ability to ask questions, the education part, all of that was something that we wanted to include, in addition to the fact that by doing this, okay, so our call center has business hours, but by doing this, it really puts it in the jail's hands to figure it out from there, right? So that they can do it when it makes sense to them, whatever their day looks like. So to give you an example, if I had said, this wouldn't happen, but if I had said, let's physically send someone over to the jail from 10 to noon on whatever, that's putting their work in our hands, kind of, so to speak, because it's a challenge for them just to get the individuals to that space. So that was one thing that we wanted to avoid, and I think we have been able to avoid by doing this. So they have our full business hours to utilize whenever it makes sense to the jail staff to get them to the location of the phone. So I think that has worked out hopefully well too. In addition to when the behavioral health social worker is there, which, by the way, presentation says she, it's now a he. It's William Schultz, since I drafted this. So just didn't want that to throw anybody off if you happen to hear names. So the last thing I put on here is what I had mentioned earlier, in that we have our county operations in addition, and our partners, in addition to the work that we do as a consortium, the service delivery model that we have as a consortium, which performs very well, extremely efficient. But each county and consortium collaborates a little bit differently with their local partners, as you all are probably very well aware. So anything that I've said really is pertaining just to us, and it would be important for anyone to, if you have contact with any other county agency, it may look different as to how they handle this. So, but hopefully some of what we've done here will, maybe motivate folks to do something a little bit differently than manual processes, which is what a lot of counties are doing. So any comments or questions?
Anybody?
Good information.
Yeah. Bob?
Yeah, I just want to thank you, Rhonda, for presenting on this tonight. I think you did a nice job, and I think there, just to point it out, maybe the obvious, is that people coming out of jail have a lot of barriers facing them, and our intention is to assist them or support them in whatever way we can so they don't end up back in jail or some other crisis event. And, usually when you think about this, you think about behavioral health interventions or some kind of other direct care intervention that prevents that. But what Rhonda recognized and helped to identify was a problem with healthcare funding that was affecting people leaving jail. They were another barrier to their getting the kind of health care that they needed or the food that they needed. So by identifying that problem and finding creative solutions working across departments and within the consortium, we were able to, or she was able to find solutions to the problem and help to resolve them so that people now leaving jail have a better chance of having their Medicaid reestablished once they're out, getting the health care they need, whether it's behavioral health or primary health care, and another barrier is removed for them in terms of their staying out of jail, staying in a more supportive kind of situation. So anyway, I thought it was a good example of working across departments, divisions, and being creative and doing some of the things that we outlined in our strategic plan that we said we would do.
Yeah.
So that was my reason for asking her to come, and I hope you found that.
Yeah, I mean,
helpful.
as I said, whenever I present, it's life-sustaining services that we're administering. It's food, it's healthcare, it's prescriptions. Prescriptions are important for stability. All of those things are upon release. Then in addition to that, just the efficiency part of not having someone in our lobby with nothing and no idea about what to do and what's available. That's not good for our department or our staff either. So really, it's kind of a win-win-win when you look at it that way. The other thing I wanted to just say is that IT facilities, jail, I mean, I'm just impressed with our partners, just in terms of, it's like open to ideas, yeah, let's get this done. And it honestly took way less time than I even thought it would. So I just can't say enough about our partners. I think that, they just get it. So appreciate that.
Well, thank you, Rhonda.
Yeah, thank you.
Next item, updates from Health and Human Services. Is that
It's me. Thank you, Chair. So first of all, happy holidays to everyone. I know we didn't have a meeting last month, and with the new year coming, my reason for giving updates oftentimes is just to bring you up to speed on what's been going on, and it's been a couple of months, so I thought this would be helpful. Hopefully you've had a little time to read through this, and maybe you'll have questions when I'm done. I won't go through everything. I just want to hit on some of the high notes here as I go through this report. But feel free to interrupt me at any point. I was going to start with the strategic plan update. I know Deb had requested that we provide one as to our progress on our strategic plan initiatives. And what we did on our strategic plan was we had 5 directives, strategic directives, and under each of those then we developed goals for how we were going to achieve that general directive. And I listed them here. Under Pursue a Culture of Change and Innovation, I think Rhonda just provided an example of that, but under that particular directive, there was a goal of starting also a communications committee within HHS to establish a more formal and a more comprehensive communication plan within the department so that we could keep all of our staff in all of the divisions at least informed about what was going on across the department and find ways in which we could communicate that more effectively and keep those communications in a place where everyone could find them archived somewhere. So we did form a communications committee. I drafted a charter to help guide the committee members on how to think about this, and Colleen sort of almost voluntarily agreed to be chair of that. So she's had a couple of meetings so far. They've had a couple of meetings so far, and are moving forward with surveying staff and finding out more about what it is they want to know. How do we communicate with like the healthcare campus, who a lot of people there maybe don't check email or check the bridge or go to intranet site to look for information. So how do we make sure they're kept in the loop on stuff that as a part of their work they just might not routinely come across, things like that. The other strategic areas that we are focusing on continually are analyze workflow to improve service delivery. Constantly, that's a focus of our management meetings. In fact, our management meeting agendas are structured so that agenda items fall within one of these strategic directives typically, so that we kind of know where those particular efforts fall within the strategic plan. It helps to keep us sort of focused on where we're going with that particular effort. And then aligning budget priorities with our vision. Sometimes that's difficult to do because of the structured funding streams that we have to operate under. So they're, whether it's a grant or state funded or state initiative, you know, we have to do what the funding source says in order to get the funding. So we don't always have flexibility in how we do that. But wherever we have that flexibility to think about providing services or doing things in a way that move upstream of the high cost kinds of situations that we're trying to prevent, which as Faye indicated, you know, is detrimental to our budget. As we try and look at a philosophy of moving upstream of crisis situations, we want to try and develop our strategic plan moving forward to support those kinds of efforts wherever we can within our budget. It's more cost effective, and oftentimes it's better care for the people that we're trying to serve. And then I guess the next one would be explore and expand a legislative advocacy. We also formed a legislative advocacy committee. It's made up mostly of managers, and it's really kind of gaining steam now with the legislative cycle coming up. But what we intended to do with this was to really sharpen our focus on legislative priorities that would apply to our county or to the western region, and look at, say, association, the different association legislative platforms, and try and pick those items that most apply to us or that we have the biggest investment in, so that we can go to the legislators in the spring and present them with a one-page legislative agenda from St. Croix County after we run it by you, and you know, be more selective and more focused on which legislative items we want to support or inform lawmakers about. Part of that, as we move forward, will be focused on some bills that I'll talk about toward the end of this report. And then division updates, just some highlights, but under administration, I mentioned that we've, thanks to Administrator Witt, we were able to hire a quarter-time Spanish interpreter as a limited-term employee to assist with the increasing demand for to serve Spanish-speaking clients. And we were able to hire Deanna Bertram, who started, about 2 weeks ago? About 2 weeks ago, and she's shadowing Claudia Early, who's our current Spanish-speaking staff member. And we think what this would do by hiring this additional quarter-time position would be to reduce our dependence on the language lines that we currently have to use if Claudia is not available. And they're expensive and they're cumbersome when you're trying to work with somebody in the moment. So this would, I think, provide better client care and reduce the cost associated with the language line fees, which I forget what they are, but they're $1 something a minute. So that adds up when you're trying to translate. And the other thing that we're doing that I think is going to be very beneficial is we've partnered with the University of Wisconsin River Falls Modern Language Department with Carlos Rojas. He's an assistant professor in that department. And what we're doing is we're able to send them documents, informational documents or forms that we want translated to Spanish, and he presents those to his class, and they use that as a class project, or those forms and documents, and translate them, and then he proofreads them at the end of the semester and sends it back to us free of charge. So we don't have to pay for that, and it gives the students an opportunity to translate documents into Spanish. So we're trying that out this semester. I think he's already sent back a couple of forms that we've provided his class with. But we hope to keep that going semester to semester. And then just anecdotally, too. We seem to be seeing an increase in residents coming to the services center in need of food, gas, and housing assistance. Under the Public Health Division, Teresa Babbage retired after nearly 20 years of work as the Public Health Nutrition Manager, and the Public Health Division, Kelly and Lori, are actively trying to recruit for that vacancy. I'll move on to behavioral health. Stephanie Grier was serving as an interim supervisor for emergency services and adult protection, and as of December 4th, she accepted the position as a permanent supervisor in that area. So we welcome Stephanie. She'll be working alongside Natalie Radich. Shar mentioned that there's rental assistant funds available through a supplemental mental health grant. I think that's block grant dollars? Yeah. Through a supplemental mental health block grant that helps to provide up to 3 months' rent for service-connected clients, our clients, who identify as having a serious mental illness. And these could be people transitioning out of jail or hospitals, group homes, etc. And I think that's for 1 year that we have that funding. 2 years. Wow.
It ends in March, I think. March
Oh,
24.
through March, so just a limited time, but still that's helpful. And then I wanted to mention that we received year 3 state opioid response grant dollars, $259,000, that we'll be using a lot of which to purchase additional products and treatment costs associated with opioid use and stimulant use. So these SOR grant dollars help to pay for treatment for people with any opioid use history, or people with stimulant use like methamphetamine, cocaine, or something like that. We used grant dollars from year 2 that we needed to spend down. We used that on buying a lot of Deterra drug disposal kits and Narcan that we still have some, but we're distributing across the county. Children's Services received a grant for, let's see, it was is it kinship care?
Caregiver needs.
Yeah, caregiver support grant for about $10,000, just under $10,000, that will help with kinship care recipients or level 1 foster homes. So this grant money would be used for things like gas, food, child-specific equipment, and activities that support positive family interactions, with the goal being to help, I wrote it down, help identify like key areas to support basic needs of families and help the kids and families stay together. Rhonda is actively working through economic support, working through the unwinding of COVID-19. Benefits were assigned to people, or I should say benefits couldn't be removed from people during the public health emergency that was in place. So now economic support is in the midst of reviewing everyone's health care and food share benefits to make sure they're still eligible. It's no small task. I made it sound way simpler than it is. And let me skip along here to Aging and Disabilities Resource Center. So the ADRC also received an independent living support grant. I think we talked about that in one of these meetings in the past. It's about $90,000, and it'll help to support support individuals who are older or have a disability, help them continue to live in the home and provide services and supports to them while they're in their home. There was some bad news, at least initially, around ADRC base funding. If you remember, the legislature approved $5 million in additional funding to go to ADRC statewide, so $5 million spread out amongst all the counties. Well, the DHS came up with a new allocation formula that took all of the existing money that ADRCs were getting and the $5 million of new money, combined them, and then redistributed all of that across the state to the different ADRCs using a fair and equitable methodology. Well, the fair and equitable methodology resulted in us losing $76,000 a year, which didn't sit well. So we're going to approach that through our Human Services Association, who is making this one of their agenda items and talking with legislators about at least not reducing our ADRC base funding, and maybe looking at just redistributing the new money in some different way. Yes.
Is that a formula that, I guess, DHS came up with and the legislature approved, or is that just something that the legislatures defined that DHS to determine the formula?
That's a good question, and I believe the legislature approved the dollar amount. DHS worked with a private entity to come up with a methodology for how to distribute it, and it was based on factors like age of the population, a number of things. I don't remember, but the formula ended up with about 15 to 16 counties, I believe, receiving a reduction in their annual ADRC funding.
Well, especially when you consider our county is one of the largest, fastest growing counties in the state percentage-wise. Yeah. It doesn't make sense. I'd understand if we didn't get any of the new money, basically what you said, but yeah, taking some away seems imprudent.
That was our reaction to it. Now what they're going to do is keep our base funding at the same level for the next 2 years, and then after that, based on this, it would drop by about $76,000. That's a position, you know, without any kind of increase. So we're obviously we're going to make our feelings known about that, and I'm not sure, Supervisor, if the legislature is aware of this, if they know that they're increased. My guess is they perceive the increase as being beneficial across the state, and it didn't work out that way. So I try not to be critical of DHS, but in this particular case, I couldn't help but be. So.
And not to argue the state's point, but St. Croix County has a younger population than everybody north of us. So
yeah,
and that's what played into that formula. So we may be growing faster, but it's the younger population in St. Croix that's growing. No, they're not. Not in St. Croix County. Not statistically, anyways. Sorry, Doctor.
I mean,
and that's a good point, Administrator Wood. That's a good point. Our counter to that, though, is that our base funding hasn't increased since 2008. So. No, I know you're not. I know you're not, but that is their argument.
We're going through the comp plan for the next 10 years for the county in community development, and our median age is still expected to go up over the next, 2 decades or so. So maybe our overall number of young people, most of the people coming into the county are younger, but our median age is still going up.
And again, our base funding hasn't increased in 15 years or whatever it is. Yeah. So I understand. I understand that. I think our point is to say let's not reduce anybody's funding. Let's use the new money in ways that are more, maybe are more equitable for those counties with older populations. And okay, I'll get off that topic. Sandy just mentioned that her census remains high. Again, as you saw in the financials, we're able to maintain a higher census, but to do that, we have to use our temporary agencies to help staff us. So our hope is that going forward, we'll be able to increase the number of St. Croix County employees and reduce the number of pool staff that we have to use because they're more expensive and you don't get that same consistency of care that you do with permanent staff. But she said that the census numbers are higher, as Administrator Witt mentioned too. The Medicaid rates have increased, which helps to support us even with these increased costs.
Yeah, the administration committee last night recommended adopting a new wage grid, which will help with that specific issue. So the wage grid is designed to make us more competitive in the marketplace, and hopefully we can fill some of those contract positions then with staff positions and actually save money.
So this would be another wage grid adjustment. Didn't we do one another one within the last year? I'm just.
Now, 2019 was the last time that we
Sure.
adjusted the grid. So this grid adjustment is not designed to increase the current employees' compensation. What it really does is it makes us more competitive in the marketplace for recruitment. So if you look at the grid from the old grid, the bottom comes up and the top goes up, which makes it a more competitive range for hiring in. So we'll be able to recruit and hire employees. All the existing employees are just placed onto the new grid at a rate that doesn't result in a decrease in pay for them. So no one's going to get a pay cut. We will see some compression issues. That's something that we'll have to deal with. But it's really a recruitment tool so that we can address issues like that and across the other departments experiencing the same thing. So you'll see that in January at the county board.
And the main, the part of the workforce that's most challenging at the healthcare campus right now is recruiting nurses, LPNs and RNs. So what Administrator Witt just said is going to be very, I think, helpful in doing what I mentioned about getting some permanent staff at a competitive wage. So. New HHS positions, so thank you for your support in the 2024 budget. It allowed us to look at some new positions within children's services, ADRC, behavioral health, that I think will help us not just respond to the current demand, but help us get ahead of the curve a little bit and provide additional support to families and individuals who receive our services in order to again, to prevent those higher cost situations from developing where people end up in higher levels of care that cost more. The one position we're waiting on is a case manager, social worker position that would be in our behavioral health division but would serve families involved with CPS who have substance use concerns. And the idea there was to work with families in their homes or in the services center in a more focused way to help them with addiction kinds of needs and hopefully, again, keep the family united and prevent those kids from going to out-of-home placement. We have to, what I was saying was we have to wait on that position because it's contingent on opioid settlement dollars that we haven't received yet. Just mentioned the CJCC Behavioral Health Subcommittee because I wanted to just acknowledge that we're working in that committee on looking at the system of care that responds to persons with criminal justice involvement who oftentimes cycle through emergency departments and jails and other crisis services, referred to as frequent utilizers or high utilizers of care. They're the most costly, a small percentage of people, but they're the most costly in our healthcare system and in our criminal justice system. And they often have the most complex kinds of needs. So what we're trying to look at in the CJCC is how do we divert or deflect those people with those kinds of behavioral health needs who present in the criminal justice system? How do we provide them with the kinds of support and ongoing care that they need in order to prevent them from cycling through these high-cost, poor outcome environments? We're drafting a white paper that will look at that from an academic point of view, kind of a lit search research paper, doing a lit search now for a research paper that will outline the current status of things in St. Croix County and where there are gaps in care and where we could make improvements. And then we'll make those recommendations to the CJCC and to all of you in terms of policy change or anything else that we think would be helpful around designing a better system of care to reduce those costs and see better outcomes for that population. Let me just move on to legislative bills to watch. Senate Bill 462 and Assembly Bill 467, their companion bills. Both are in support of funding for regional crisis stabilization or urgent care facilities. Kind of like the one we tried to get funding for about a year and a half ago. It was a withdrawal management program that we proposed running out of Kitty Roads. So it's a similar kind of concept. The legislature, I think that this bill currently was, an amendment was made in the Senate and went back to the Assembly now for approval. But it looks like it will dedicate $10 million annually for 2 years, I believe, to start regional urgent care facilities. But in the bill, because of our efforts, I think, in the bill, there was language that emphasized the need to have one in the western region of Wisconsin. Again, this kind of option would allow for law enforcement to drop someone off at a facility like this without waiting for medical clearance and just leave and go about their business. A facility like this is typically a 5 to 7 day length of stay, treats addiction, treats mental health kinds of crisis events, and then helps those people get connected to somewhere in the community where they can have ongoing support and care. They're expensive to run because they're 24/7. You have to have RNs on every shift, and you have to have medical oversight. You have to have behavioral health professionals. So you have to staff three shifts, 7 days a week. And so we're waiting to see what DHS comes up with. They're supposed to draft an RFP once the legislature finishes with the bill. I think it'll get support. And then we'll see what the RFP says in terms of dollar amounts and requirements. And then we'll repropose that idea again if it looks like we could do it. Again, this would be contracting with an outside organization to come in and operate it. I don't think we could find the workforce to do it, and I'm not sure we're really capable of operating a facility like that with county staff. It would be a huge undertaking, and I would rather contract for it. So that's the plan if it moves forward. Another bill that I think we need to really keep a close eye on is the 1115 waiver application. That's a federal waiver that would allow Medicaid dollars to go to pay for people who stay in IMDs like Winnebago, institutions for mental disease. Current Medicaid law doesn't allow Medicaid to pay for services in an IMD, and this federal waiver allows at least limited funding through Medicaid to pay for those client stays. That's where a lot of our purchase service costs come from, is people staying in IMD settings, and Medicaid won't pay for it. FAA does a good job of trying to recoup through third-party insurance or private insurance some of the costs, or through the clients themselves, but we don't recapture much of that money. So this particular effort is something we went through in Minnesota. I was a part of that effort. It's lengthy, it takes a while, probably a couple of years, but if successful, this would reduce our purchase service costs for IMD settings substantially. Around the state it would. So I'm hoping DHS takes it seriously and makes a concerted effort to get this waiver approved. These waivers are not just pieces of paper, they require statewide reform, so it has to include a plan, a state plan, for how to reform mental health and addiction care, which the state has started to do. Yeah.
I've got a couple questions on that white paper you're talking about. Do you have like a time frame range even where that would be published or ready for review?
The RFP?
No, the white paper.
Oh, the white paper.
Yeah.
There are stages of the process we want to go through,
Sure.
so I'm guessing by fall.
Okay.
Yeah.
And then for any of these, I guess, initiatives, have we looked at using part of the jail expansion project, doing something with that for any of these types of projects?
We haven't specifically. I would say what we're already doing around having a social worker in the jail and working to expand Medicaid-assisted treatment within the jail, those would be areas we would look at in terms of expanding or developing further. I haven't looked at, as far as the jail expansion goes, as far as what that would mean for us to do things beyond what we're already doing.
Right. I mean, because it seems like, the type of facility we're going to put, we talked about putting in Kitty Roads. It seems like you could just have a separate wing in the jail, expanded jail, that would serve the same or similar purpose.
The challenge with that would be people that are not criminal justice involved persons who want to use that service, and I don't think they would go to a jail for that service,
I guess I'm not saying that it would have to even share a lobby, just kind of be, I guess, part of the scope of the project in the same, I guess, general area as the jail, if that makes sense.
I think we'd have to look at that closely, and again, that RFP that DHS will put out will specify what kinds of environments qualify. Typically, they're CBRF. They're licensed like the Kitty Roads facility is already. So I'm not opposed to looking at creative ideas like that. I just think we have to look at what the RFP and licensure restrictions would be on the kind of setting you could do this in. That's going to determine, to a large extent, what our options are, I think, yeah. I mean, it's a creative way to think about it. It's interesting. All right. Xylazine test strips. So I have a handout. I don't know if all of you are familiar with xylazine. This is a drug that's an animal tranquilizer. It's not an opioid, and it's infiltrating the drug supply across the nation. So xylazine test strips test for this particular drug in other drugs that somebody might be taking. The reason that's important is because the user of other drugs, whether opioids or methamphetamine or whatever the drug might be, usually don't know that xylazine might be present in the drugs that they're doing. So by testing for this, it can prevent somebody from overdosing on xylazine, which is a strong sedative. It's not an opioid, but it's a strong sedative that can cause cardiac or respiratory failure and other kinds of sedative effects. So this bill would allow for xylazine test strips, which are now designated as drug paraphernalia, to not be designated as drug paraphernalia and to be designated in the same way that fentanyl test strips are. Essentially, it's a form of harm reduction, again, to prevent the users of drugs from accidentally taking a drug they're not intending to and potentially overdosing. And just a point about that, too. So this legislation would do that, right? It would remove the designation of xylazine test strips as drug paraphernalia. So Narcan, just so you know, Narcan won't work on xylazine if somebody overdoses. But it's still a good idea to give Narcan because it will reverse the effects of any opioid that's in the system. It just won't help with the xylazine overdose. It's a very dangerous drug, very powerful drug, and it's either put into other drugs as a way to enhance the effects of the other drug or just as weight to make the product more expensive. So that's a bill we're watching, and then expanded kinship definitions would expand the definition of caregivers for children beyond the current rather specific designation of family members, and would expand that to, I don't remember the definition, but it would expand it to include close, not relatives, but people who have close relationships with the family could be considered in the kinship definition, to prevent kids from being placed outside the home and still place them with somebody who's familiar with the family and has that kind of relationship. And then finally, Shar and I are attending a legislative event, the WCA legislative event in Madison in early February, so we'll have a better idea of what their priorities are. The Human Service Association put out a list of priorities for their agenda, so we have an idea of what they're focused on. We're planning another mental health symposium in the spring of this year, of 2024. And right now we're looking at focusing that symposium on young adults who may be experiencing behavioral health crisis. There was some reason for that, given some recent events with younger people dying by suicide in St. Croix County, and we want to look at that topic more closely and look at possibly the generational differences with kids now in college or young people, the pressures that they're facing that maybe we didn't or people my age haven't in our lives, and trying to examine that more closely. Some really early stages of developing the symposium, so we'll be meeting in the first part of next year to start developing a better agenda for that event, and maybe partner with the colleges if they're interested. And lastly, the things I put in here were just projects that we're involved with that I think require or deserve a little additional attention. Recovering Together cafes are going quite well. In St. Croix County, we're having wait lists even to get into them. Again, these are informal supports for people in recovery. People with young kids can come there and have free childcare, get a free meal, and take part in an evidence-based curriculum that's peer-led with professional supports available. Those are once a month. I send Adam the announcements, and he puts them on the website. So if you would like to read more about them, they're on the website. Shar and I we were invited to attend a DHS Secretary Roundtable meeting in Eau Claire. When was that? This week, I think, or last week. I don't know. Last week. It was recently. And that was the DHS Secretary and Attorney General are holding these meetings around the state to talk about how counties are using opioid settlement dollars to combat opioid addiction. So they invited 2 representatives from our county, and Shar and I went. We told them what we were doing with our opioid settlement dollars and other grant dollars, and so did Eau Claire County. And then the last thing I was going to mention was the Recovery Support Solutions Project. This is the outpatient withdrawal management project that's in partnership with Western Wisconsin Health. It offers physician oversight, behavioral health supports, peer supports for people that might be withdrawing from any drug who present at the hospital. They don't have to go through the emergency department. They can contact the hospital directly if they're experiencing withdrawal or challenged with withdrawal, and just be enrolled in this program. It's not really enrolled even, it's just participate in this program where they can receive assistance with withdrawal through medication-assisted treatment and physician oversight, like I said, and then connect them with any program in the county, including ours, for any ongoing support. We're trying to double down on our marketing here because the attendance or the recruitment for that program has been slow, which we kind of anticipated. But we're working with Adam, and he's helping us to develop a marketing strategy to make this more, to extend our reach in terms of people that might benefit from this, and hopefully get them directed to Western Wisconsin Health. All right. I'm sorry, that was longer than I meant to be, but do you have any questions about anything in there?
Anybody have questions? No? You did a good job then.
Okay, good.
Thank you. Any future agenda items?
Chair. I do have a draft of the ordinance for that defines the local health officer's authority to put on the agenda for next month.
Okay. Any announcements or correspondence? No? Yeah. Bob?
Dr. Anwar might have one.
So, to my surprise, I am moving to Minnesota, just over the river in Lake Elmo. New baby, so we needed a bigger place, and the housing market has been tough. So I'm just as surprised as any of you. but I will be moving to Minnesota. I feel I haven't accomplished 10% of what I wanted to in my short tenure here. There are a few candidates that I will speak to and make referrals to you and the HHS. And I also want to offer, if possible and if everyone wants, I can continue serving until the seat is filled by someone qualified and someone that everyone wants.
Well, thanks and no thanks.
Sorry, I didn't anticipate moving so quick. The baby this year is what changed things.
They have a way of doing that.
Well, thanks for being here in the short time too. And maybe we'll ask you to speak to us again.
Sure, I'll still be working at Western Wisconsin Health,
Okay.
and I'm only going to be moving, I think it's about 10 minutes from where I'm currently at in Hudson, so not too far away.
Yeah, well, thank you. Any other correspondence, announcements? Date of our next meeting is January 17th at 5 p.m. So until then, have a happy holiday, everybody, and be safe.